Come in.
Hi, my name is Gianna and I'll be your nurse today. Can I please have your name and date of birth?
My name is Ellie Mascarello, and my date of birth is February 30th, 2005.
Okay. Can I please have your preferred pronouns?
I go by she, her.
All right, mine are she, her as well. Are you experiencing any pain today on a scale of 0 to 10, with 0 being no pain and 10 being unimaginable pain?
No, I'm at a 0 today.
Okay, perfect. So what brings you in today?
I've just had a bad cough and a fever for like the past 5 days, and it's not really getting any better.
Okay. Have you had any chronic health conditions previously that I should know about?
No, I don't have any past health conditions.
Okay, good. And then when did your symptoms first start and how often are you experiencing them?
I've had the cough and fever for about 5 days, and my symptoms seem to be like pretty continuous, I would say.
Okay. Have they been getting better, worse, or staying the same?
I'd say they've been getting worse.
Okay. And then where have you been experiencing this discomfort? Can you point to the location?
I've just had some like chest discomfort like on my right side.
Okay. Can you describe what the symptoms feel like, and on a scale of 0 to 10, how would you rate it?
It feels like a sharp pain with the deep inspiration and a cough that I would say is pretty severe, and on a scale of 0 to 10, I'd probably rate it about a 6.
Okay, and how much are you coughing or producing sputum?
I feel like I cough pretty frequently throughout the day and even at night too. And my cough is like a wet cough with like yellow-green stuff coming out.
Okay. Have you noticed any other symptoms along with it, like fever, chills, or fatigue?
I've experienced fever, chills. I feel like I'm getting more tired. I feel like I have short of breath when I do activities. But I don't really have a sore throat or feeling of any like congestion in my nose.
Okay. And what seems to make your symptoms worse?
Whenever I breathe in super deep and whenever I'm like laying flat.
Can you tell me how the symptoms started and how they have changed over the time?
They started as more of like a mild dry cough and just like feeling tired. And then they kind of progressed to like a more wet cough, fever, and then the chest pain as well.
Okay. Well, thank you for telling me all that. But we're gonna start with your skin type and usual care. So what are some of your usual skin, hair, and nail care products?
I use like lotion, normal shampoo and conditioner. I don't use any like medicated things for my hair or my nails.
Okay. What are some of your self-care activities? For example, skin self-exam, sunscreen use, and sun exposure.
I examine my skin occasionally, and I use a lot of sunscreen, and I haven't really been exposed to too much sun lately.
Okay. Have you noticed any rashes or skin lesions?
No, I haven't.
And do you experience itchiness or pruritus?
No.
Okay. And have you observed any changes in your skin color, anything like that?
Yes, I have. I've kind of been feeling pale and just kind of like flushed whenever I have a fever and stuff like that.
Okay. Do you have excessive dryness, oiliness, or moisture of the skin?
Sometimes my skin is like a little damp. I feel whenever I have the fever mostly and some sweating.
Okay. Do you bruise easily, or do you have any current bruises?
No, I don't.
Okay. And do you have any sores that are not healing?
No.
Have you noticed any changes in a mole?
No.
Have you had any skin infections recently?
No, I haven't.
And have you experienced any problems with wound healing?
No.
Have you noticed any changes in the color, consistency, or texture of your hair?
No.
Have you experienced excessive hair growth in any areas?
No.
And have you had any hair loss or baldness?
No.
Have you noticed any problems with the color, consistency, shape, or condition of your nails?
No.
And do you bite your nails?
No.
Do you use artificial nails?
No.
Have you ever been diagnosed with skin, hair, or a nail disorder?
No, I haven't.
Have you ever been diagnosed with a health condition that affects your skin, hair, or nails?
No.
And do you have any intolerance or allergic reactions to skincare products?
No.
Are you regularly exposed to dyes, chemicals, or toxins in your environment or workplace?
No.
How often are you exposed to the sun, including during car rides or outdoor activities?
I have minimal sun exposure, just sometimes during like being outside or if I go on a walk.
Okay. Are you ever exposed to areas where ticks are common, such as wooded or grassy areas?
No, I'm not.
Okay. Well, that is it for your exam. Do you have any other questions or concerns for me?
No, I don't.
Okay, I'm gonna leave your call light here with you.
Thank you.
Thank you, and I hope you have a great day.